we can study transmissions on cars all day long. And if you make a better one, we can probably put it back in the original car and it'll still run along with the engine and all the other stuff. That's how we think about systems, and that's how the body is taught. But the problem is that your body is actually not divided into systems. Some man probably came along and decided to do that to make it easier to understand. But in doing so, he told a great lie. I don't know a better way, by the way. I'm not saying he did the wrong thing. But if the car analogy was true to your body, that transmission would also be doing stuff for the engine and for the body of the car and the suspension. And the suspension would be part of the engine, and the engine would be a little bit part of the body, and that would feed back in the other thing. Your body is not systems, really. It is systems, but they're all intertwined. So let me give you a really good example. Your cardiovascular system. Your cardiovascular system is essentially your heart, and its job is to pump blood around my body. That's its job, right? And it takes blood to your bones. Your bones are not dead, by the way. It takes blood to everything, but it takes blood to your bones and keeps them alive. However, in turn, while your bones are supporting you, your bones also create red and white blood cells inside them that fill up the circulatory system and make sure, by the way, it has blood going to it, because your heart actually needs its own blood supply. So your heart is pumping the blood from the bones that it also feeds the bones with back to itself to feed itself. Of course, it's hooked up to the lungs because that's how it gets oxygen in to take to the bones and the heart. And you see how this all starts to get kind of confusing? And so what I mean is to just cut the heart out and say, well, the heart is a pump and there's these systems of tubes and that's a system of the body. You start to fail to really see how integrated these systems are, and that somebody arbitrarily broke these apart. We're going to see that true with the muscular system too. We're actually going to see it true with every system of the body. And later we'll even understand that the book that I love, this trail guide book, that some of these pictures in it are actually lies too. Not quite the kind of lies you might be thinking, but still lies. So anyway, we'll get to all that good stuff. I just want to explain to you that we are cutting the body into parts. It's like me chopping off my hand so we can study my hand. But hands don't work without forearms, and forearms don't work without arms. Right? So it's not that simple. Okay, so hopefully you can see the skeletal system of the body here. Right? Your skeletal system does all sorts of things. By the way, it's about 206 bones. There's some super teeny tiny ones inside your ear even. But for our purposes, what we're concerned with is your skeletal system that we further divide into two skeletons. One is the appendicular skeletal system and the axial skeletal system. So what you see here in red is the axial skeletal system. It is the axis of your body. I think I've mentioned this before, but don't worry, I will mention it again and then mention it again and probably mention it again. So it is the axis of your body that the rest of your body operates off of. It's also the thing that carries all the really important stuff. Like my brain, my heart, my liver, my stomach, my intestines, the really important stuff, kidneys back here, are all carried in the axial skeletal system. And in fact, in some ways, you could argue that the appendicular skeletal system's job is to carry the axial skeletal system around and help it get stuff to feed itself with. Right? So my axial skeletal system is my legs and my arms. I'm sorry, my appendicular skeletal system, I really apologize, that's terrible. My appendicular skeletal system is my legs and my arms. So, with my legs, I can carry my axial skeletal system over here and get something to eat. With my appendages here too. So again, axial skeletal system, appendicular, your appendages, legs and arms. And we make this distinction for lots of reasons in massage especially, and in physical therapy and sports and stuff like that, because it has a lot to do with how you move. And so the axial skeletal system is your skull and your spinal column and your ribs. And where stuff connects off that tends to be high areas of stress. So, real quick example. Silly example, but really true. When I have a body on the table, huge oversimplification, right? Huge oversimplification. But I care a lot about the spine because it's made up of 24 vertebrae, so there's actually 24 joints there, and that's where all the nerves come out, right? And then I care about where the appendicular skeletal system meets the axial skeletal system because those are areas of high stress. And those are shoulders and hips. So a lot of times in massage, I'm actually trying to think about cutting somebody's arms and legs off their body. I mean, obviously I'm not visualizing it there with a knife, but you'll hear me use those terms like chop the arm off the body. And what I really mean by that is trying to open back up these areas where my appendicular skeletal system attaches to my axial skeletal system. And you wouldn't have a terribly bad massage if you worked the heck out of the spine, the shoulders, and the hips on everybody. That'd be a good start. Throw the feet in, you're probably done. So, because these are the areas of high stress, think about where you ache right now. Very likely it's in your hips, back, and shoulders. Very likely. One of those three places, or all of those three places if you're extra lucky. Okay. So the skeletal system, axial skeletal system, skull, vertebrae, ribs, right? Sacrum. Sacrum actually connects the two hips together. They're a very important joint. The job of your skeletal system is to protect your organs. That's one of the things it does. My rib cage is there to protect my very precious heart. You break that thing and there are problems. But let's not forget that my skeletal system does other things. It produces red and white blood cells inside the skeleton. Now let's just think about how amazing this is just for a second here, before we move on. This building that I'm in right now has steel girders in the walls. They're pretty strong. Your bones, pound for pound, are stronger than steel, though. Pound for pound, stronger than steel. Pound for pound, stronger than steel. And these girders, I can't like run a tap next to them and get chocolate milk out of them. Now, you can't get chocolate milk out of your bones either, I get that, but they make red and white blood cells. So they are not only the structure for your body, but in their part-time, they also produce all the stuff that acts as like a defense system for your body, the white blood cells, and they throw in the red blood cells there too, just so everybody can absorb oxygen and get rid of CO2. That's what they do on the inside of them. That's kind of amazing. And we're going to find your body has a lot of overlap. So for that reason, I asked, should you put the bones in with the skeletal system or should you put them in with the cardiovascular system? Could you have a cardiovascular system if you had no blood? No, you couldn't. You'd have a pump with empty tubes, which is called a dead person. But you cannot. You cannot do that. So maybe we should put the skeletal system in with the cardiovascular system. Of course, it makes white blood cells too, so should we put it in with the defense system for your body? I don't know. Anyway, of course, then they need it over in the skeletal system. So anyway, that's it. By the way, your bones are essentially made of fascia, which I'll explain in a second, that's filled with calcium and potassium. Kind of like fascia filled with concrete. Anybody ever see them building like a highway or a bridge where they've got all the concrete and they've got all the rebar stuck in there, it's all the metal stuck in there? Okay. They do that because concrete actually is not terribly strong unless you have some structural reinforcement stuff in there. And once you do that, the stuff becomes amazingly strong. We all see it when we go to work every day, right? When you drive over a bridge that's made out of solid concrete and then it's got 17 cars going over it and the thing doesn't even waver. That's amazing, and that's concrete and rebar. You take something like stone and you put metal through it, and you've got a very strong substance. Well, your bones are kind of similar. You don't have little steel bars called rebar, but you've got fascia running through, and fascia is connective tissue. So it is very much, I know I've said this before, but we'll be saying it a lot. Fascia is connective tissue, and the connective tissue you're probably most familiar with is off like a chicken breast or something. So you'll see it in two places. One is at the end of the chicken breast, you'll sometimes see a little white cord there. It's very tough. There's no way you could chew through it. If you've I'm sorry to be gross, but if you've actually got it in your mouth, you probably chewed it for a while, and then you were on a date and you tried to discreetly kind of put it over here and not let them see that you're spitting your food out, right? That's a tendon, but a tendon is fascia. It's made of connective tissue. You also might have actually peeled off a very thin saran wrap, thinner than that, see-through layer of something over the top of the chicken, and that's the same fascia as what's in that tendon. It's just a very thin sheet of it instead of a rope of it. But that's connective tissue too. And if you've ever boiled chicken and then shredded it apart, you know how it shreds? It shreds because there's fascia around each of the fibers, this wrapping, and that's why they shred along the fascia. Anyway, your bones are actually made up of a lattice network, like a pantyhose network of fascia that's then filled in with like plaster of Paris, although it happens to be calcium and phosphorus. So it'd be like if you had kind of some stockings and then you poured concrete in them. You'd actually have a pretty tough stocking at that point because the fibers weave in with the concrete stuff, and you've got this very dynamic source, and that's what your bones are. And in fact, when you break a bone, when I break this bone here, it's the fascia that grows back first between the two and gives you this soft connective network here, and then it gets filled in with the calcium and potassium and becomes solid again. Amazing. Amazing. Fascia's everywhere. Okay, and by the way, that gives you guys bones, by the way, that are really strong, but actually have a little bit of flex to them. You actually want them to have flex to them, and they do. Your bones have a little bit of flex to them, and they can be, we'll get into this later, but they can be dynamically strong. They can actually change the way the fascia is growing in them over time, and the way that your calcium and potassium is built up in them to take stresses from different angles. So if I'm an Olympic ice skater and I'm doing lots of lateral movements, my femur will actually have more lateral strength built into it, and you can actually see it under a cross section or an MRI. And if you are somebody who hikes straight like this, you'll actually see the strength bands running up and down in your legs and such. So our bones literally change based on our activities. So they're alive, they're thinking, they produce red and white blood cells for the cardiovascular system, even though they don't get included in it. But they don't complain, they just keep holding you up. Skeletal system. Okay, cool.
You're fascinating.
Fascinating, thank you. So they're fascinating. Okay. So bones are constantly remodeling, and by the way, we're going to do whole sections on this, but you do have a little overview test on this tonight. They're constantly remodeling, and what that means is that your bones are breaking down all the time, and they're being rebuilt all the time. That's a good thing. And in areas where you don't need them as much, they don't rebuild as thick there. In areas where you need more thickness, they rebuild thicker there, and they constantly get broken down and built back up again, which really means they're dynamically changing to suit the environment. It's one of the reasons that, by the way, you can't just take calcium supplements if you're trying to get stronger bones. You actually have to stress your bones. They need to do some weight-bearing exercise of some form, because otherwise, when they're rebuilding, they get no signal that there's any need to build up extra calcium there, and your body doesn't just say, oh, I've got calcium, I'm just going to lather it on somewhere, right? And you wouldn't want it to do that because it might lather it on right here, right? You want it to go to places you need the bone, and so you actually have to stress those bones for that to happen. So we have 206 bones. Babies are born with 300 bones. What do they do with the 94 bones? I mean, I know kids lose a lot of stuff.
Do they grow into more bones?
Yeah, they do. So they're both, yeah, little kids are very cartilaginous. They're very fascia, and that's why they're very bouncy. And many of their bones will actually fuse together. So, and then we count them as one bone. Your sacrum, everybody, the upside down triangle between your gluteus maximus and your gluteus maximus, your sacrum used to be like 4 or 5 vertebrae, and they fused together and became one, and we call it your sacrum. But if you look at a sacrum, like look at it on the skeleton when you come to school or something like that, it looks like 4 fused sacrums together, 4 fused vertebrae together. It's got little holes coming out of it. It looks like that's exactly what it was. Same thing is true with your coccyx. It used to be a couple of things that all came together. Same thing are true with your hips. Your hips are actually made out of 3 big bones that get glued together over time. Cool.
Hips as in the pelvis bones?
Mm-hmm. Yep, your pelvis bone, and that's why we actually don't usually call them your pelvis, believe it or not. We call them your ilium, your ischium, or your pubis, because those are the 3 bones that make it up, and it depends on what part of the hip we're in. Yeah, and we'll learn that later. Ilium, ischium, and pubis, those are pretty important to know. Your hyoid bone, these are just tiny little interesting facts. Your hyoid bone is the thing that people think is your Adam's apple, but it's actually not your Adam's apple. It's actually cartilage here. And on men, by the way, it tends to be more pointy like this, just tends to have this angle, and on women it tends to be like this. So it looks like men have bigger Adam's apples, but what they have is sharper Adam's apples. And it's not always true. And it has nothing to do with anything, by the way. So if you have if you're a woman with a very sharp Adam's apple or a guy with a very flat one, it doesn't mean anything. But in general, guys tend to have a little more pointing out there. Anyway, your hyoid bone is a bone that's actually in that area, and it's the only bone that's not really attached to any other bone in your body. It's a free-floating bone. It is hooked by muscles and tendons and all that kind of stuff, so it can't go flying away. It has a lot to do with how I can talk and use my tongue, but it's a free-floating bone. It is the bone, though, on detective shows that often gets crushed when somebody gets strangled because it is a tiny little horseshoe bone in your throat. So, yes, Miss McDowell.
I thought the patella was a free-floating bone.
Miss McDowell, I am desperately trying to find some reason that I can justify what I just said based on what you've just said. Not connected to another bone. But it is.
I mean, it's on top of bones, but I mean, you can rip it off if you're not careful, right?
Well, okay. So, by the way, I mean, short answer is I think you're right and I'm wrong. But the longer answer is the patella is hooked to the tibia, right? I mean, that's what the ligament does there. It is hooked to another bone. And I think the hyoid is not, but then I was just thinking about the hyoid is hooked to one tiny bone in your temporal thing. I think the reason they're saying that, and this is a book thing too, by the way, you're quite intelligent. So both your patella and both your hyoid are what we call free-floating bones. They're not really like locked down to something. You're 100% right about that. I think the argument that somebody might make is it's probably basically true, although I have to look up one thing about the hyoid, is that the patella actually does hook by a ligament into your tibia. That's what it does. The hyoid really doesn't hook via stuff into other bones. But that's not totally true because I can think of 2 bones where it does. You know what? You're right. I'm wrong and the books are wrong.
The books are just wrong.
Yeah. There are 12 free-floating bones in your body. And I will now teach it that way from now on. After 26 years of massage therapy, 6 years at this school alone, I will now teach that there are 11 free-floating bones. Your hyoid is 1. Your 2 patellas, which are also called sesamoid bones, which are bones wrapped in tendon and ligament, are, and you have 8 other sesamoid bones that I'm not going to tell you about right now. Good job. Now I'm wondering why they say stuff like that. Anyway, So I disagree. The hyoid bone is connected to another bone as much as the patella is, anything like that. Huh. Okay. And we talked about osteoporosis already, but it's a common disease of your bone where they're not as dense as they should be, really. Low bone density.
Could you say that the name of the horseshoe bone in your neck that you were talking about one more time, please?
Yeah, and it's on my slide here too. It's the hyoid bone. Hyoid. Hyoid bone. It is a free-floating bone in that it's not directly attached to other stuff, but it is attached to other bones.
And another one, another free float. The scapula is free floating, right?
And the well, yes, but the scapula actually has direct bone connections to other bones. It does. But it is very free. It's very free-floating in back. It can move in back quite a bit. There's nothing holding it on your back side besides muscle.
Oh, okay.
But you would have to break a joint to remove the entire scapula. Whereas you would not have to break a joint to remove the hyoid, or, as I recently found out, the patellas.
I don't want to break any joints.
Yeah, don't do that. That's true. That's not good. That's not good massage therapy. Okay. Okay, there are various types of joints. You won't hear me talk about this much. They're important to understanding some basic concepts of movement. Like, I'll give you an example. My elbow is a hinge joint, right? And hinge joints can only do what a door can do. They can only open and close. I actually can't move my arm to the side like this. Now you're like, but Tapscott, you just did move your arm to the side like this. But that's not my elbow doing that. That's my shoulder doing that. My shoulder can do that, but my elbow can only do this. If I don't move my upper arm, I can't get, it's either flexion or extension. That's all that guy does. He's a hinge. Those are my only choices. And so hinge joints and any type of joint give you an idea what kind of movement you might get out of it. The way I'm able to rotate my head is because my C2 vertebrae has a little tooth up here, tooth-like projection, and my C1 actually rotates on it. And so they call this a pivot joint. It's actually the only example I can think of in your body of a pivot joint. And that's how I'm able to turn my head. So some of this stuff gives you an idea of what things will do. I have two examples of ball and socket joints in my body, my shoulders and my hips. And balls and socket joints tend to give you things like circumduction. They tend to be able to do lots and lots of different stuff. Because it's a ball and a socket, so it doesn't just open and close. It can go side to side, right? And it can rotate. So ball and socket gives you your most mobility. And then thumbs are really kind of interesting. So way down here in your thumb is what's called a saddle joint. And a saddle joint is like two saddles facing over each other. Well, this one can move this way. And because the other one's this way, it can go like this. So they can kind of get flexions and extensions, but they can also kind of get abductions and adductions because they can go through two different planes. Very cool. But that's why we bring up joints. Just to give you an idea of how much movement is allowed at that area. Your carpal bones, you've got 8 of them. Those are gliding joints, which just means they're little bones that do this. Well, when you get a whole bunch of gliding joints, you can do some pretty neat stuff. And that's what happens when you get 2 rows here. You can all of a sudden start to get all sorts of movement in there. So that's just different types of joints. You will not every day at work be like, oh, this is a gliding joint. Okay. Muscular system. And in general, we mean the voluntary muscular system, the one that we're in control of. Your muscular system actually has 3 different types of muscle in it. It's got cardiac muscle that you find around your heart. It's got skeletal muscle, which is the muscle that we use to move stuff. And it's got smooth muscle, which is actually around the inner tubes of your body, basically. So even your blood vessels have some muscle around them so they can control opening and closing of your blood vessels. So maybe we should put muscles in with the cardiovascular system. Yeah, anyway. They're also around your smooth tissue in your body through your digestive system too. There's smooth muscle around there. It helps you move food through and everything like that. But right now I'm basically just talking about your big muscles that we think about that actually move your body. Skeletal muscle. And remember, all they can do is contract, shorten, pull, and that's how we create movement. When I am back here coming towards you, my muscles are pulling me there. Even if I'm going away from you, my muscles are pulling me away from you. Pulling me laterally, pulling me laterally. All I can do is pull. They are pulling on levers to make me go. It's true there's about 320 pairs of muscles. We'll learn about 100, which might get you to 200 muscles because we learn them on each side of the body. Obviously, they're the same. And we'll later talk about how they're named, but they're all named differently depending on who discovered them. So pay attention because there are some things that stay the same and some things that don't. Cool. Miss Hanson, do you remember from today that any muscle going to the thumb has what word in it?
Sorry. It starts with the H, right?
No, that's the big toe.
Oh, the big toe, but it starts with a P.
This is the P. So thank you. That's good enough. So I'm sorry, by the way. She's like, where's this coming from? Out of the set of blue. But there are 8 muscles that go to your thumb, everybody, and they all have the word pollicis in them. It's a good word just to remember. If you remember pollicis, somebody could walk in 10 years from now and be like, blah, 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 pollicis, and you're like, oh, I know that has something to do with the thumb. I know it's right here. Like, that's 8 muscles that you've kind of already got a rough idea, and there's some other tricks you can do to figure it all out. And if it has the word hallucis in it, there are 7 muscles that go to your big toe. And they all have the word hallucis in them. So if you hear hallucis anything, you're like, get down towards the foot and get down towards the big toe. If you hear pollicis anything, it will be about the thumb. Hallucis anything will be about the big toe. That is a really good way to knock off 15 muscles and kind of have them locked back here for use later. Yeah. Cool. All right.
Hey, Mr. Topscott?
Yes, sir.
Man.
Yes, Mr. Tate.
Okay, so when you first started talking about the muscle system, you said that we were going to focus on a certain muscular system. Did you have a name for that?
Yes, I'm sorry.
Sorry.
It's not a certain muscular system, a certain portion of it called skeletal muscles.
Oh.
Skeletal muscles are muscles that hook to your skeleton and are designed to control movement and posture. We don't really massage smooth muscles, right? Because they're inside the body. They're super duper important, but they're inside the body. We don't really massage the cardiac muscle because, again, super duper important, but it's inside the body, and that's not good. So we are going to be dealing with skeletal muscles. These are muscles that are used for movement and posture. They explain almost everything about how I'm standing and moving, and that's what we'll be studying. They're generally under your conscious control, all that good stuff. Smooth muscles, by the way, you use inside your body for 2 reasons. One is to give shape and form to things, but also control the diameter of them. So you guys have a really neat plumbing system. Unlike my house, right? Like, let's say that I want to take a hot shower, but somebody else is using the dishwasher, right? And so I can't get enough hot water. If my house was my body, my house would actually expand the pipes back to my shower to make sure I got more hot water when I needed it. And your body does that. It will actually expand arteries and contract veins and things like that to control the flow of blood so that you keep stuff where you really, really, really need it. It's one of the reasons your hands do get so cold when you're cold, is your body is actually shutting off blood to them. It's not trying to warm them up. It's trying to keep your core temperature warm. So it actually shuts them off. One of the reasons your hands sweat is your body's trying to cool itself off. And these are great radiators. You run blood and water down here, and you got great radiators, and they cool you off very quickly. So your body's very intelligent. Thank goodness, too. Cool, cool, cool. So anyway, so your skeletal muscle system helps with mobility, which is movement, stability, which is standing, posture. You could argue it's part of the circulatory system because the heart is a muscle. Helps with circulation. It moves your diaphragm, which is your main breathing muscle, is a muscle. That's how you breathe. That's how you breathe in. So your muscular system makes sure that you get to breathe. So it really helps your circulatory system. In fact, you couldn't have one without your muscular system. Of course, you couldn't have a muscular system without your circulatory system because your muscles would die. That's it. Oh, it helps with temperature regulation too, I forgot to say. So muscles are kind of cool, but they also generate a lot of heat. And so when you're shivering, you ever shivered before? Your body's doing that to actually fire up your muscles to try to make them generate heat to warm you up. It's actually fairly effective. Yes. When people run into problems is when they can't shiver anymore because they've run out of energy. That's hypothermia. That's something totally different. Cool. Yay. Okay. I want to love this picture. I want you to love it, but it's very hard to understand this picture. But what they've done is they've taken a chainsaw and they've cut somebody's head off like that, cauterized it all, made it all nice and pretty, and they are showing you the cross section of that person's neck. And they're doing it because they're trying to make a point about fascia. And I will try to make a point about fascia too, but it's hard to make. But very essentially, you are bags wrapped in bags, 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 and then wrapped in bags. Probably that many layers. So, for example, let's take a little muscle cell. Little muscle cells. Muscle cells are really good at one thing. They're really good at contracting, right? Anybody ever had filet mignon here? Filet mignon steak? Good, Miss Brown. Was it tender?
Oh yes, it was delicious.
Yeah, tender and delicious. It's tender and delicious because it has almost no fascia in it. Because muscle, which is a filet mignon, by the way, is a muscle from an adorable little cow. But anyway, it's a muscle. It's really good at contracting, but actually muscle is very, very soft, very prone to tearing. And so what you do with muscle, even if you have a single little muscle fiber like this, is you wrap it in fascia. And that works really well. It really does, actually. It's kind of like the plastic casing around a little piece of wire, right? But you got to understand, in my arm here, I've probably got, just in my bicep, I probably have, I honestly don't know, 1 million fibers? Maybe 1 million? So anyway, my body takes all these, wraps them, Then it takes groups like this and wraps them, right? But there's other groups like this around. So it wraps all them after that, right? And that's just the bicep. We haven't even gotten past like the other stuff, and it wraps that again. And that's what they're trying to show you with this cross section. Fascia is everywhere. It is the inner coating around everything, and it gives stability, structure to your body. It's wrapped around your bones. It's within your bones, really. It's wrapped around every single muscle fiber. It's wrapped around groups of muscle fibers. It's wrapped around muscles. It's wrapped around groups of muscles. It's wrapped around organs. It's wrapped around nerves and the nerve wiring. It's found at the end of muscles. It attaches bone to bone. You've got sheet-like tendons of it. You've got everything. Yes, Miss Walker T.
So fascia, like
like when you have those foam rollers, you roll your legs or whatever. What is the actual benefit of? Because I would imagine that's, I don't know, softening it up or
Yeah.
breaking it down a little
Yeah.
bit. I don't.
Yeah.
What is it? Why does it help? Why
That's
are you
essentially what I would imagine too. I mean, so you're probably doing three things that I can think of off the top of my head when you're foam rolling. And you're probably, well, it doesn't matter what you're talking about. Meaning it doesn't matter what part of the body. I mean, for one thing, you are massaging the muscles too. I don't mean to underscore muscles. They're very important. But muscles respond very quickly to massage. They're very vascular. They allow a lot of blood in and they respond really quickly. Fascia doesn't respond quite as quickly, but its health is extremely important. So when you roll over it with a foam roller, you are increasing circulation to the fascia, and just like everything else in your body, it's alive, it needs blood for life, and that makes it healthier. And when fascia is healthier, it tends to be more elastic. So you're making your body stretch more, stretch better, and spring back better too. So I'm not even talking about necessarily being able to stretch further, but being able to spring back from that stretch, although probably both. You're probably unsticking the fascia too. So there's all these layers of fascia, and they do get kind of stuck together sometimes. And in general, you don't want them stuck together. You want some glide and some movement and things like that because people are kind of bound up in their own bodies. So those are three things. You got the muscle thing, but you also got bringing blood to the fascia and unsticking it. And I guess you could argue you could be directly stretching it too, depending on how you're pressing in there and stretching it out. But I'm rolling it out like a rolling pin. And it's very effective and kind of painful.
And you said like our tendons are made out of fascia, right?
Mm-hmm.
So we do want some length to our tendons. They do need to be able to move and.
Yeah.
Okay.
Yeah, actually, if you'll wait 1 second, I'm going to grab something because your question is really good. So hold on 1 second. Let me grab something. All right. Now, I know, pardon me, I know that this, whoa, let me just do that, let's stop sharing, hold on. I don't know what I'm doing. I know that this is saran wrap, but please with me for a second, let's pretend it's fascia because it's pretty close. It's thicker, but this is like the sheet-like stuff you can take off the chicken breast. And you peel it off, and you're like, wow, that stuff's thin, but it's actually fairly strong for something so thin, right? And it's stronger than the saran wrap, so this is not a great example. But, so this would be like fascia. And it's pretty similar. By the way, if you rolled it a lot with a foam roller, it would stretch out some, all that kind of stuff. Hold on. Almost there. So that was fascia. There we go. Okay, stop. Okay. And this is fascia too. But remember, like water coming down from the sky we call rain, but it's still water, right? So we just call stuff by different names to it. This is fascia too, but this is layers of fascia, and it's sheet-like, and we call it aponeuroses. And we have some in our tummy, abdominal aponeuroses, and we have somebody on our back, the thoracolumbar aponeuroses, and we even have a little shower cap on our head called the Gallia aponeurotica, which just always sounds wrong, which I love. Gallia aponeurotica. But it is sheet-like fascia. Yes. Cool. So that's fascia too. Watch this. Same fascia, rolled up kind of like ribbon. By the way, it's pretty much your IT band here, but anyway. Also, ribbon-like fascia underneath your wrists and your ankles is called retinaculum. You ever see Olympic gymnasts wrap their wrists and stuff? Mother Nature already wrapped them. I'm not saying they shouldn't wrap them twice, they should. But my point is, if you pulled back their skin, you'd see the same wrapping. They're already wrapped. You guys are too. Your wrists wouldn't be that strong if they weren't wrapped in retinaculum. Then, bone, another bone. No longer ribbon, rope-like, ligament. This is ligament. By the way, that's saran wrap. Your fascia is stronger than this stuff. This stuff's amazing what happens when you put it in layers, right? But this is designed in particular ligaments to hold bone to bone. If this was a muscle over here, this would be muscle to bone. It'd be a tendon. But it's all fascia. And it's layers and layers and layers and layers around stuff all over your body. So some people actually argue that the fascial network is much more important than the muscular network. But those people are brilliant, so don't listen to them. Okay. Let's go back to, sorry, the slideshow. Okay. Questions about fascia? Fascinating. No? Maybe? All right, let me present this. Yes, Mr. Rydell.
Yeah. So is there like a way to promote like fascia like regenerating it or
Yeah, fascial health. Yeah.
Yeah.
So fascial health, yeah, there is some stuff. In fact, you'll hear athletes talk about fascial training now. So a couple things that really make fascia better is hydration. By the way, it is very prone to dehydration. And there's the way fascia is made, it has a liquid component to it. And so hydration is really important. General good nutrition is important too. Believe it or not, some people argue, and I think they're probably right, that acid balances in your body matter when it comes to fascia. And that's a whole long discussion about that. But the fact is nutrition could affect your fascia quite heavily. Circulation affects it, both from within and without. So good cardiovascular circulation helps your fascia be more springy. Massage from the outside definitely helps it to be more springy. And last, and certainly not least, stretching it. So two types of stretching. So kind of the stretching you might do in yoga where you are stretching and holding. But fascia, believe it or not, also responds well to bouncing. You have to be very careful you don't tear something, right? But like a runner, for example, a runner is really bouncing along on the fascia of their calves. It's not just the calf muscles. They are bouncing. And that is elasticity created from their fascia. And as they bounce more, their fascia gets thicker and more elastic there, and they get better bouncers. Yeah, which is why you see some people do sports where you're like, it almost looks effortless for them. Yes, they're in amazing shape. Yes, they're in amazing cardiovascular shape, and yes, their muscles are very strong, but they're quite often also bouncing along on their fascia because it's their fascia that's amazing. So they're kind of like Tigger, you know? Because I'm the only one. Yeah, Tigger. And any conversation ends with Tigger. It's kind of a good one. So yeah, really responds well to circulation enhancing things. And temperatures, you get fascia warmed up, it tends to perform better. So a lot of massage therapists are trying to warm up the body so the fascia is more malleable. Cool. And fascia, by the way, has nerve sensors in it, so it can sense your relative position in space, and it can experience pain too. These are all cross sections of your arm and such, trying to make this point about muscles being wrapped in fascia again. Don't overthink it. We'll come back to all this. We really will. But, by the way, one of the most famous fascial bands is your IT band, your iliotibial band, which is the band down the lateral side of your femoral compartment that tends to be a little sore, right, on most people. And that is a fascial band. It's meant to kind of give your knee integrity and your thighs integrity, all the muscles around there. In fact, actually all the muscle on your leg kind of wraps around and becomes the IT band. The IT band isn't this separate thing just hanging out there by itself. It's connected in with the fascia around your leg too. It's just a thicker portion of it. It's really fascinating. If any of this seems confusing right now, it's because we are just introducing the movie to you, so to speak, that you have decided to attempt. So don't worry, we have entire homework assignments and lectures on fascia or on the muscular system or whatever we're talking about. Yes, Mr. Tate.
I didn't quite catch what you said about the IT band. Did you say it was superficial?
It is superficial. It is superficial. It's very superficial, but it runs down my leg here on the outside, and it is part of the fascia of my leg itself. So it's not just a band just hanging out. That's the problem, is we're like, oh, IT band, IT tract, it must be all by itself. It actually is woven in with the fascia that goes around my leg too. It is just a thicker portion of that. So another way to think about that, if we can, another way to think about that is to think if my pants were fascia, which is only one layer, and you wadded them up on the outside here, my pants would be everywhere, but they would be thicker here, and this would be my IT band. If that helps. I hope it helps. Mr. Blygen.
It did. Thank you.
You're welcome. Mr. Blygen, sir.
Are you able to see the IT band on that leg model back there?
Yes. You are. And this is the IT band running down the leg. This white band of fascia. But don't be fooled by this model, because remember, all of this is coated in fascia, and all the little fibers in here are coated in fascia. This is just a thicker band of fascia going down the side. Again, we separate stuff so we can understand it, but it's not that cut and dry. Yeah. Yes, Mr. Tate.
So you said that it's going down the leg. Shouldn't you say that it's going down the femoris? A part of the like the upper part of the leg is called the femurs, right? It's not part of the leg. Nice.
You guys today, between you and Miss McDowell. Yeah, you're 100% right. It is the femur. It's going down the lateral side of the femur, or the femoral region, and it gets down to the proximal part of the leg, and the lateral proximal part of the leg. And so you're absolutely right. It's the majority of it's on the lateral femoral compartment. You're absolutely right. I said it completely wrong. That is not the leg. You're absolutely right. Anybody else? See how it is. Are we 8 days in? Okay. More fascia. By the way, some people believe that fascia holds kind of an emotional memory to it, which isn't as crazy as it might sound. Because, for example, if I've kind of started to carry myself this way because of some emotional situation, this does not mean everybody hunched over has an emotional situation. But let's say I'm depressed and such. My fascia is actually now growing this way to help me hold up my head, believe it or not. I'm actually developing a lot of fascia back there. And so it kind of holds this memory of this person. So in retraining people's bodies, you may be retraining some of their emotions and how they feel about themselves. We know 100% for a fact that when you hold yourself up like this, you feel better. We know that. So as you try to help people hold themselves up better, you will be changing how they feel. There's no doubt about it, or aiding in that. It's kind of exciting. Oh, by the way, these pictures back here were kind of good. You guys see the flexor retinaculum? That's the bands of fascia going around the foot, but you see how it's tied in with all the other foot fascia? Like it's fascia, but there's a band that's kind of part of that, but kind of separate. That's how your IT band is. Does that make sense? They're trying to show you the fascia around the leg, which is everywhere. It's everywhere, and this is the leg. But then the retinaculum is a thicker portion kind of going around there, but it's everywhere. Does that make sense? All the wrinkly stuff you're seeing there is fascia, all of it. The retinaculum happens to be a thicker strip of it, woven into the rest of it. Yeah? Okay. Cardiovascular system. So it would be nice, we're going to do the cardiovascular system in here, but it would be nice for the rest of your lives if you can remember that the heart is a 4-chambered pump. Everybody should know that. Like by the time we're done with this class, we'll all know that. It's a 4-chambered pump, and that arteries take blood away from the heart, and veins take blood to the heart. Arteries in general are under high pressure and take blood away from the heart, usually, but not always, full of oxygen-rich blood. Veins are low pressure and are returning blood back to the heart. They're all just tubes, just really long tubes in your body. And is this picture a picture of all the veins and arteries in your heart? No, this is like the freeways and maybe the streets and avenues. But it is definitely not all the residential stuff, and it's definitely not the driveways. Because you literally have veins and arteries over every square millimeter of your body. Have you ever taken too long to repot a plant and you lift it up and there is roots around the entire bottom? You can't see the dirt anymore. That is the level of veins and arteries you have in your body. They are everywhere. They're tiny by the time they get to that point, but they are everywhere. Veins and arteries are everywhere. Yes. And when blood is red, it's full of oxygen. And when it looks blue, it's actually just darker red. It's oxygen depleted. It changes color based on its oxygen content. So the reason all the blood you guys have seen is red is because you see it outside a body. And there's oxygen outside the body. If we were in outer space and we cut ourselves, we'd have lots of problems, but we would also not have red blood out there because there's no oxygen to turn it red. Be nice and dark red, look kind of blue. Yes, who raised their hand? Oh, Miss McDowell, yeah, please.
Isn't blood like directly from the arteries? I mean, I know you're saying it was under pressure, but isn't it like a deeper red than like if I cut my finger?
Oh, you mean because it's under pressure or because it's got more oxygen in it?
Well, I do you know why that is? I mean that.
I didn't know that
I'm
was.
talking about like I thought it was darker. Like the blood was darker if it comes from an artery.
No, a vein.
Like if it gets cut.
Yeah. I mean, I'm not aware of the thing you're talking about. It doesn't make you wrong. I'm just not aware of that.
Okay.
I'm just aware of a color change that takes place because of hemoglobin in your blood, and when it bonds with oxygen, your blood tends to look brighter and red and lighter, bright red. And when it's not present, your blood tends to look very, very dark red, which people call blue, purple, things like that, but it's very dark.
In general, if it's coming out of an artery, it'd be very, very bright. And then like a normal vein would be a darker color.
Well, but I would think it would all be
Yeah.
bright because the minute it hits oxygen, it should be bonding with oxygen right away. So I don't know if you'd know.
I thought she was, yeah, I've heard the same thing, Bailey.
Yeah.
Yeah, like first aid, I think that's what they say, like, oh, you know, it's an artery, it's like super bright red blood, but if it's little, it's
I will tell you, I'm sure you're right, by the way, and I just don't know. But I will tell you when it comes out of an artery, it comes out a whole lot faster.
yeah.
It is red, by the way.
It is bright red when it comes out of an artery?
Noticeably bright red.
Oh, and a vein, no?
No.
Oh.
Not red. It's like a dark.
So the color change is present even when you cut a vein. Interesting. Okay. Cool. I know. Wow. All right. Yes, Miss McDowell, sorry. But so back to the heart, four-chambered pump, arteries take blood away, veins take blood back too. Cool. And we will do a whole section on this. Oh, and by the way, I think for homework you might have to name some of these arteries and veins. 2 things. One is, I don't expect you to memorize these names for the rest of your life. Please don't kill yourself with them. It's not that important. We really have the exercise in here because what we want you to realize is the artery in the brachial region of your body is called the brachial artery. The artery going in your axillary region is called your axillary artery. The vein in there is called your axillary vein. And what we're trying to get you to start doing is being like, just using some common sense, because we know you won't memorize all this. Nobody would. It doesn't make any sense. But we want 5 years from now when somebody says, well, it impinged the axial artery, you'll be like, axillary region, oh, armpit. It must be a pinched, artery in the armpit. Like, it'll click back in, and that's what we're really trying to get here. Because we find that that is more effective than memorizing. There are some things you have to memorize in this class, but this is not one of them. So I will not be drilling you for the rest of class on the names of veins and arteries. This is just an exercise for you to see how learning the regions of the body really helps with the arteries, and we're going to find really helps with the nervous system. We're going to find really helps with the muscles, because we use a lot of similar words. Cool. Your nervous system, same thing as the flower pot. It's literally that prevalent in your body that every single last area has got this tiny, tiny wire going to it. And when they all come back together, they form your spinal cord and go up to your brain. And that's how everything in your body works. They're all wires that attach your brain to the rest of your body so it can feel what's going on, and attach your brain to the rest of your body so it can tell it what to do in response to what's going on. And that is the nervous system. And again, we will not be learning every last nerve plexi here. This is just to show you how naming works in here. But I did tell you something very important about the nervous system last week, about how to know what section of the spine might be pinched when people are having problems. Does anybody remember this? Good. Does somebody want to talk about it? Answer questions about it?
Yes, please, I forgot. Sorry.
Oh, that's okay. No, I understand that. But you don't remember, right, sir?
Right,
It doesn't matter. We're going to go over it. I was wondering if somebody like Miss Walker Y would tell me, you nodded. Man, don't do that. No poker face.
I think I know some of it.
Yeah. I just want to know, like, if, and by the way, this doesn't mean it's always happened, but if I've got pain in my arm or hand or any of this kind of stuff in here, what part of my spine could have a pinched nerve?
Your neck, your cervix.
My cervical spine could have. Thank you very much. And if I have pain in my chest, abdomen, anything up here, front or back, I could have a pinched nerve in my where? Thoracic region. Brilliant, by the way. And if I have a pinched nerve in my lumbar area, where could that be?
It can affect like your legs.
It can, and specifically it can probably affect my anterior legs. The lumbar actually reaches around and comes down the front of my legs. The sacrum goes down the back of my legs. And so those are just good places to check for impingement. Now, please don't think that when somebody walks in and says, my hand hurts, you go, aha, pinched nerve of the neck. Knew it. It might be that. It may not be that at all. It's a good place to check. The reason I don't care if you guys memorize the exact nerve that goes to this one spot in the body is that most nerves, like your brachial plexus that we talked about, it goes to like 4 spots in your neck. And I'd rather you work the whole neck anyway, because we want to loosen it up. We're not surgeons, we're not cutting, so you would work that whole area anyway, but I want you to have a good idea where to go to look for problems. Cool? Thank you. We will talk about this many times again, the nervous system. But your brain is considered to be the central nervous system. Remember, we have the axial skeletal system, central nervous system, brain and spinal cord. It's the brain, and the spinal cord is just all the wires coming off it. It gets smaller and smaller as those wires break up and go out to the rest of your body. And all those wires coming off the central nervous system, off the spine, are called the peripheral nervous system. It's in your periphery, out to the sides, peripheral nervous system. So you got your central nervous system and your periphery, your peripheral nervous system, which is really everything off your spine. It's everything that has to eventually get back to the spine and back up to the head to tell you what's going on. Mr. Brown, please.
I don't know if you said it before. Is the solar plexus connected to the nervous system, or would that be a part of the muscular system?
I'm pausing because I don't know the answer to this question because I don't really identify this. I know what you mean, the solar plexus, but the solar plexus isn't a thing, it's a location.
Oh,
Now, I understand
okay.
it's a location that's highly sensitive, but it's highly sensitive because it's in there by the diaphragm, and it hits just the right stuff around the diaphragm. So, I don't know that I'd lump it in with anything.
Because I was looking at this slide here, and it's got like the cervical plexus, thoracic plexus. I thought the solar plexus went in with cut the plexus.
I don't think there is a solar nerve plexus, if that's what you're talking about.
Oh, okay.
There's a sacral plexus, which is your nerves coming off your sacrum, kind of down by your tailbone, but not a solar plexus for your nervous system that I'm aware of. So I think you're combining two different things. Lymphatic system. We will have a whole module on this as well. Your lymphatic system is essentially your bulk garbage collector for your body. So as your circulatory system pumps blood around your body, coming out through your arteries, going down into your capillaries, getting into the interstitial fluid between your cells, only 90% of that blood gets picked back up and gets back up to your heart. 10% is a lot of blood to leave behind. And it's leaving behind blood that has usually proteins and things like that, but sometimes foreign invaders, all sorts of stuff. And if it's too big to get back into your capillaries, and if it stays there, you're going to swell. And sometimes people do. But your lymphatic system actually has lymphatic vessels, tubes, that are bigger than your capillaries, and they will pick this stuff up. They will pick it up, and it will go through several lymph nodes on the way back, which are like little filters, and they're full of white blood cells, and it will clean up this lymph along the way, and then it will take it back and dump it back in the heart once it's all cleaned up. And your lymphatic system is really part of your defense system and part of your cardiovascular system. It's part of all sorts of stuff, but it's quite amazing. And lymph runs on very low blood pressure too, so light massage tends to stimulate lymph actually. And a very interesting thing, these little lymph nodes, by the way, when you've gone to the doctor before, they've felt your throat right here. They were feeling your lymph nodes to see if they're swollen. It's one of the signs that you might be dealing with an infection here, is if my lymph nodes are swollen. So it's just a really easy way for a doctor to check. Well, those lymph nodes are all over your entire body, but the majority of them are where you bend, just like our endangerment sites. So I've got a lot of lymph nodes here. I've got a lot of lymph nodes, believe it or not, in my inguinal area, where I bend, in my inguinal area. A lot of lymph nodes in my stomach, where I bend. A lot of lymph nodes in my neck, where I bend. Elbows, backs of knees, that's where you find the most lymph nodes. Good little rule of thumb. And they can be accidentally massaged. You wouldn't want to dig in on one on purpose, right? You're just going to make it more inflamed. So it is good to kind of know that if you shouldn't really be in the back of a knee or an armpit, but let's suppose you are, you're around the neck and you can feel some swollen little things that feel like frozen peas under the surface of the skin. Those are probably lymph nodes because of the area you're in. And you can assume that they're already inflamed. Don't go rubbing on them. You're not helping them. You're not going to kill somebody, but it's not good. Okay. By the way, you'll see that they threw in bone marrow into the lymphatic system because your bones are where you make white blood cells, demonstrating the overlap of all these systems and such. I think that's it. Yeah.